cleaned. Some we do not have representative for this.
Yes, you didn't respond to me either, so.
No insurance commissioner today, and Secretary Eisenberg as well. We're not featured.
Got it. Okay, well, a small group. Well, welcome everyone. Thanks for being patient. 5 minutes delayed. I was just sharing here. I don't know if that were on. We were probably muted. But for those who've been around the legislature, one of our long-term staffers from many years ago who had been retired while Joyce Taylor had passed. And so her service delayed me 5 minutes, but we've got a little life. Joyce had a full life, and we all like healthy full lives, and that's why we're here. We like healthy full retirement and healthy full lives, and so I thank the team and the staff for pulling this together. I know how busy everybody's been with RFPs and budget hearings and just life and coming through the chaos of elections and cycles and all. For me and Representative Bombach, who's transitioned out, and Representative Harris, who will be coming on board. Senator Townsend, hello. I know he was going to be here in person, but sometimes our family, little ones, decide to pick a day to get sick. And so, Brian, we know that you are here, Senator Townsend, with me. Feel free at any point in time to jump in. And intercede, but hopefully everyone has their agenda. Today was more of one of those meetings of let's get caught up, let's talk about transition. Obviously my role is going to be shifting, and it certainly will be up to Senator Townsend, Representative Harris, members of the General Assembly, the role of the retiree subcommittee. But in the meantime, when I talked to the incredible team here, they felt, let's get together for an hour, maybe less if we don't talk as long, to see where we are, what's occurred, approve past minutes, and then end knowing that with the leadership of Senator Townsend, Representative Harris, we can then have a path forward in the new year in 2025. Does that sound good? Okay, so I don't know if you want to start with a little bit of a roll call quorum you have. If you want to, do you want to just go through who you have here in case somebody else has joined that we missed?
Absolutely.
And it looks like Representative Harris has joined us, so that's great. Okay, go ahead.
Yep, so other than the Lieutenant Governor in person, we do have Wayne Emsley, Bill Oberly, and David Crate logged in virtually. I do have Representative Harris, Senator Townsend, Secretary DeMatteis, Jeff Tashner, and Denise Allen. Is there anyone else I might be missing? If you could just raise your hand and I can promote you to a panelist.
Okay. All right, so we have everyone that we're gonna have for now. Awesome. Okay, so with that, we're gonna jump right in. If you all could not believe it's been since April, that's why I wanted to have this meeting. I thought it was important. Does anyone have any comments? Obviously grammatical or other changes we can share with the team for the SEBC RHBS meeting minutes, April the 18th. I will need a motion for approval and a second.
So moved.
I have a motion. Do I have a second?
Second.
And a second. Any comments, discussion by anyone on the minutes? I'm sure you're frustrated cobwebs. Remembering those. Okay. Hearing none, I shall call the question. All in favor, signify. Those voting members can unmute themselves. Signify by saying aye.
Aye.
Aye. Online. Any abstentions? Hearing none. Any nays? Hearing none. The minutes hereby stand approved from April the 18th. Thank you all so very much for that. So we are going to turn over now to agenda item number 3, which is post-employment benefit updates. And I think you have the team online to give us an update, right?
And I'm actually, Lieutenant Governor, I'm gonna let Joanna Adams do the introductions on this.
Yes, Joanna Adams will do so, who has the most beautiful grandson, by the way, who I got to hold at Returns Day. That is-
You haven't seen mine.
Oh, I know all these beautiful grandbabies, and he was heavy too.
Yeah,
He was very healthy. Okay, Joanna.
Thank you very much. So with us today, I'd like to introduce Beth Mercer from Chiron. So as a reminder, Chiron conducts our annual actuarial evaluation for our pension funds as well as the OPEB trust fund. So she's here today to present the results of that actuarial evaluation. Beth?
Hi, good afternoon, everyone. Thank you, Joanna. So you can go to the next slide. These are the results as of 7/1/2024. And this first slide has a high-level summary of how the results have changed since the prior year, and we'll get into some more of the details about what's driving the changes on the next several slides. But we have the total actuarial liability increasing from 9.6 billion last year to 11.1 billion in 2024. And the market value of assets, so this is the fair value of assets, has increased from 687 million to 957 million. This is due to much more contributions going to the fund due to changes in the funding policy. As a result, the total unfunded actuarial liability has increased from 8.9 billion to 10.1 billion. And the funded ratio, this is the market value of assets divided by the actuarial liability, has increased from 7.2% to 8.6%. So since the prior valuation, the population was fairly stable with an increase in the active participant counts and a small decrease in the inactive participant counts. And overall, the participant counts in total increased by about 1,000 people to 79,500. Okay, so the next slide, if anyone has any questions, I can take a pause too, but we'll go over.
We have a question, since you're on that slide, go ahead.
So Beth, on the pension side, we kind of smooth the asset returns. We don't do that on the OPEB side.
No, we don't do that on the OPEB side. And as the assets grow due to the funding policy, that may be something that we could consider changing to and sort of smoothing out the asset gains and losses over time. But yeah, but for the OPEB, we just use the market value of assets right now.
Thank you.
Thank you. That's good to know though, because I do think that is something over time that's going to be important to reflect. Okay, continue. Thanks.
So for this valuation, we reflected updated participant data, and the actives increased by about 2.5%. The inactive counts decreased by 0.6%. We also reflected some programming changes that were made in response to the actuarial audit that took place this year. So these changes had a minimal impact on the liabilities, and otherwise we didn't make any changes to the demographic assumptions this year, but when we do our next experience study, we'll review the demographic assumptions and make updates as necessary. We updated the discount rate that we use for determining the actuarial liability. So this increased from 3.65% to 3.94%. So this reduced the liabilities. This is based on the 20-year bond buyer rate at the time of the valuation. And we reflected the updated premium equivalent rate increase. So the retiree contributions increased by 27% as of 7/1/2024 and 1/1/25 for Medicare retirees. So that increase in the premium equivalent rates did reduce the liabilities. Okay, and then on the next slide, we have some more details. So the biggest driver in the increase in actuarial liability were the updated claims curve assumption and trend assumption. So we reflected updated claims curves. So these are based on actual claims experience and actual participant data. We make an age-based claim assumption, and we trend that forward to 2024. Also updated the trends to be consistent with the healthcare actuaries projections so that we are consistent with the assumptions that they're using. We found the assumptions to be reasonable based on changes in the prescription drug landscape. So these are really driving the short-term higher trends we're seeing. And these are partially due to the GLP-1 drug impacts on your healthcare costs. So as a comparison, I'm showing the assumptions that we used for the prior year for the years 7/1/24 to 7/1/25 compared to this valuations. And I'm also including the healthcare actuaries trend assumption for that period. So the non-Medicare eligible medical expense increased from 6% for that year to 8%. And the Medicare eligible medical trend stayed the same at 5%. The big change were the non-Medicare eligible pharmacy trend increased from 6.5% to 14%. And the Medicare eligible pharmacy trend increased from 6.5% to 10%. And there's more details on what's driving these trends and a comparison from prior year valuations on the next slide. This is a summary of our trends over time. So when we put together our trend assumption, we use a 20-year model that grades down over time. And over that 20-year period, it's assumed that it will reach a level that's aligning with inflation and real GDP growth and not exceeding these figures so much. So we've included the assumption that we used in the 2016 valuation, the 2020 valuation, and the 2024 valuation. So I'm showing the first 5 years of trend for the different categories, and then the ultimate trend. The ultimate trend is fairly consistent between 3.5% and 4%. But these first few years of trend can be a little bit volatile, and changes in trend is really driving some of these changes in the OPEB liability. So the OPEB liability is very sensitive to trend changes. So a 1% increase or decrease in trend for all the years would increase or decrease the liability by about 15%. And short-term trends are really volatile and can be impacted by many things, such as changes in the vendor contracts, new drugs that are coming onto the market, new treatments and technology, any changes in government regulations that are emerging, population changes, and then if there's changes in infectious disease. So that's, you can see that the first few years in this most recent valuation, they're highlighted in blue because those are really being driven by increase in costs for prescription drugs related to these GLP-1 drugs and how they're impacting your population. Okay, so the next slide just reviews the historical assets and liabilities. The gray bar here is the actuarial liability. That blue line is the OPEB actuarial liability if you are fully funded. So if you're fully funded, you can use a higher discount rate, and that's going to lower your liability. So we include that on here just as a comparison to see where you could head if you continue to fund the plan. And at the very bottom, there is a green line that is showing the market value of assets, and that has been steadily increasing. And we also include the funded ratio as a percentage on the top of the gray bar. So that is increasing from 1.8% in 2010 all the way up to 8.6% for the most recent valuation. And that's due to the changes in the funding policy and ongoing efforts to fund the plan.
Excuse me, I did have a question on page 4, if we could go back.
Yeah.
As it relates to the highlighted valuations, which include the dramatic cost of GLP-1 drugs, correct? That's the main drive.
Right.
Then I assume that's just calculated based on real-time expenditures for that drug. Is that correct?
Right. So this is based on the healthcare actuary's projection about how the GLP-1 drugs are going to impact your drug costs in the future as they're emerging and becoming more prevalent in the population. And that's really what's increasing those trends for the first few years.
There's no accounting for, I mean, we've been advised that the use of the GLP-1 drugs will
bring down the cost.
Improve our healthcare outcomes down the road. I assume that's not taken into account.
That's not taken into account, except that we're hoping that eventually the long-term costs will become closer to that inflation / real GDP growth rate. And so it's not explicitly being take into account like a lower trend assumption on the medical side.
Gotcha, thank you.
And ideally, I know with words of faith too, from a bench scientist perspective, some colleagues I know in the field across the country, there are some corporate firms who are actually coming forth with the generic peptides, because these are peptides. So again, it depends on who can compete in the marketplace and who can make those purchases. That might be a glimmer of positivity. I don't know. Right?
Yeah.
Who knows what the
That was
future of
one
the
of my
FDA holds
Follow-up
for all
questions
of
for
us.
Faith from a meeting
Okay.
this morning.
Oh, okay, yeah, there are corporations looking at generic peptides. Okay, continue, Beth.
Okay, and then this is a historical review of the contributions to the fund. So the blue bars are the contributions, that green bar is the investment return, and the gray line are the benefit payments and expenses. So historically, the contributions have been closer to that pay-as-you-go cost, so they just covering the benefit payments and expenses. But more recently, more contributions have been coming into the fund due to the changes in the funding policy, and you can really see that they are outpacing the benefit payments and expenses, and that's what's driving the increase in market value of assets and the funding ratio. So as additional changes are happening to the funding policy, this is just going to keep continuing to improve the funded status of the plan. And our evaluation does not reflect recent contributions to the fund. So there was a $56 million deposit, which is the 1% of the prior year budget, and the $199 million fund deposit. So it doesn't reflect those because they were made after the valuation date. But if they were included, the market value of assets would be more than 1.2 billion. Compared, I think it was 956 or 57 million in the valuation, and it would increase the funded ratio to more than 11%. So it would just keep going in the right direction. But that's not included in our valuation. But I did want to point that out, that has happened. And that concludes my presentation. But if there's any additional questions, here.
No, we do appreciate that update, and it's, a lot to consider into the future. And I know with SEBC, which rolls nicely into the next item on the agenda, topical areas, and it sounds like Representative Overly, you already having that conversation on some stuff. So SEBC update and legislative updates.
Thank you, Lieutenant Governor. Hi, everyone. Faith Runs, Director of Statewide Benefits. I'll kick this off, and then my colleague Stephanie Hardis, our manager overseeing the SEBC and subcommittees, is going to provide some updates on recent legislation. But I just want to, I think reflected in the conversation that we just had and information that Beth provided on the OPEB valuation. What's not reflected in these slides, but I want to make mention, the committee, in response to what we're seeing in terms of increased utilization and expenses for GLP-1s, did make some changes to the trends for the group health insurance plan for the current fiscal year. There were some adjustments made, so I think hopefully that's gonna help, at least on the health fund side, help our forecasts keep pace with what we're actually seeing as the utilization costs continue to grow in that category, specific to weight loss. But just jumping in, and Carol, thank you. Next slide. I think more importantly, I wanted to give the group a real brief update on some discussions that the SEBC has embarked upon. I think as a direct result of the work of the Retiree Benefits Healthcare Advisory Subcommittee, and comments that we've received from our retirees about the current methodology and rating approach that is used by the SEBC for setting the rates for the active non-Medicare and Medicare populations receiving benefits through the state of Delaware. I think as this group currently knows, the historical rating methodology has been that we would rate all groups combined. So what that means is as the SEBC reviews actual costs and utilization and sets rates for subsequent years, they have been making across the board rate increases for each of those three populations, even though we know that the actual experience and cost for those three groups does vary. So there have been discussions, and these will continue as we go into the next calendar year, and we transition and make some changes in membership and composition on the SEBC. There are other approaches that have been suggested from this group and by retirees for the committee to consider. They are reviewing those, not making any decisions in the current calendar year, but are gathering some historical information and really looking at more closely what the direct impacts would be to both participants in those three groups, as well as to the state of Delaware as the primary funder of the healthcare costs for our population. And just trying to gather that information in an attempt to educate the incoming committee in the event that they would want to make any changes in that methodology moving forward. So some of the options that the group is looking at are considering looking at and rating separately the active employee population from that of the retired. So that would be both the pre-65 non-Medicare retirees and the Medicare retirees combined in one group. As we know, the Medicare retirees currently today, their rates are set higher than the actual cost for that population. So in this particular scenario, that group would be subsidizing those additional costs that we see and that we have seen historically in the pre-65 retiree population. So that group is and has historically cost more than the rates that have been set for the plans that they enjoy as state of Delaware retirees. Another option that the group is looking at and considering is separating the non-Medicare retiree from the Medicare retiree. So again, there are some implications there with that, in that we know those pre-65 retirees generally cost more than our Medicare population. And in this scenario, we would be keeping our entire non-Medicare population, both the active employees and the pre-65 retirees, in one group, rating them separate from the Medicare population. In that scenario, we do expect that there would be a modest impact to the active and pre-65 population from a rating perspective, and likely see decreases in the rates that would be set for the Medicare population. And then another option that the group is exploring is really just separate rating for each of those three populations or cohorts. So there are some implications with this, which is I think the one that the committee will probably take the deepest dive in terms of looking at implications. We would be rating smaller groups. So therefore, we'd be looking at a lot more volatility from one year to the next if we broke down and rated the groups by three separate populations. It would by far have the most initial impact on that pre-65 non-Medicare population due to the additional costs for that population. And then obviously there would likely be initial reductions to the Medicare retiree population, because that group, as we know, have a lot of additional revenue streams that offset their expenses. So again, no decisions are expected to be made by the committee with regards to these approaches, but we thought it was important to share with this group that the committee recognizes this is an area of importance and of great interest, both by this subcommittee and our retirees. So there is a commitment to continue to evaluate this and consider it as we go into the next year.
Great, thank you for that. I know it's been a discussion ongoing.
Yeah, so Stephanie, I'm gonna hand it over to you, let you go ahead and provide a legislative updates.
Sure, thank you. Good afternoon, subcommittee members. This is Stephanie Hardis, SEBC and Subcommittee Manager. Just following up on our presentation we had in April this year on legislation that was introduced in accordance with the recommendations provided in the December 2024 report of recommendations from this subcommittee that was shared with the Governor and General Assembly. Next slide. So starting off with House Bill 281, which was passed with House Amendment 3 and Senate Amendment 1. This bill repeals the option in current Delaware code of providing health care insurance to state of Delaware pensioners under Medicare Part C, also known as a Medicare Advantage plan. This bill was passed by the House and Senate and was enacted without signature on June 26th, in which it was effective that date. All right, the next bill, this one had quite a few components to it. This is House Bill 282, which was passed with House Amendments 1, 2, and Senate Amendment 1. These changes take effect in the next administration in January 2025 and make significant changes to the structure, membership, and authority of the SEBC and its subcommittees. So as far as SEBC membership, this bill that passed and will go into effect on January 1st removes the Delaware retiree appointed by the Governor and adds 2 members who are Delaware residents eligible to receive health care insurance under Chapter 52, Title 29 of the Delaware Code, who are under a pension or retirement plan. So for those 2 new members, one will be appointed by the President Pro Tem of the Senate, and the second, the Speaker of the House of Representatives. This also changes the SEBC leadership structure as far as the co-chairs of the SEBC. So the chair would still be the director of the Office of Management and Budget. However, a vice chair would then be elected annually by members of the committee. The vice chair must be a voting member of the committee and may not be a cabinet secretary or hold a position of equivalent rank in the executive branch. Additionally, this bill makes the Controller General a non-voting member of the committee and allows designees to attend rather than statutory members. Next slide. Some administrative changes to the SEBC that will take place with the passing of this bill. If the SEBC or subcommittee is holding a hybrid or virtual meeting, as we are right now, the chair or vice chair must attend at the in-person anchor location. As it is currently and has previously been established, any member of the SEBC or subcommittee could attend at the in-person location. However, it will now have to be a chair or vice chair. Additionally, the chair of a subcommittee must be a voting member of the SEBC. And as far as additional administrative changes, the SEBC must approve a request for proposals to select a carrier or third-party administrator for any health care insurance plan for state employees or eligible pensioners during an open public meeting. The draft of that RFP must be included with the meeting notice and agenda and will be posted publicly onto the SEBC website. Additionally, the SEBC must provide a meaningful opportunity for public comment before voting on whether to approve an RFP to select carriers for third-party administrators for healthcare insurance plans, again, for employees and or eligible pensioners. So this bill was passed by the House and Senate, was originally vetoed by the Governor. However, the veto was overridden on June 27th, and this bill will go into effect on January 1st of 2025. The next bill we have is House Bill 330, which passed with House Amendment 1. This bill requires that the General Assembly set aside 0.5% of annual payroll beginning in fiscal year 2026 budget for the OPEB Trust Fund, and to increase this percentage incrementally by 0.25% of payroll every year until such a time as all annual contributions to the OPEB Trust Fund reach the actuarial determined annual required contribution. This is similar to how the current state pension fund is funded, which we just reviewed with Beth Mercer. This bill was signed by the Governor on September 30th and took effect that date. Again, this will start for fiscal year 2026. The next bill we're looking at is House Bill 375. So this bill makes changes to the percentage of state share paid by the state for eligible pensioners hired on or after January 1st of 2025. So this bill does not impact any current employees. Beginning for those who are newly hired after January 1st of 2025, they will now need to reach 25 years or more of service in order to receive 100% of the state share. This change would not apply to any state employees who are subject to a mandatory retirement requirement.
Requirement retirement, that's a tongue twister. All right.
This bill was signed by the governor in September and will take effect on January 1st. And just wanted to note that the statewide benefits office will be publishing the current and future rates on our website. And beginning in 2025, we will continue working with the Office of the Pensions as well as Employment Services on ways to make new employees aware of their pension and retirement benefits, and ensure that they're very aware of their retirement benefits when applying for a job with the state. Additionally, these updated state share percentages will be included in onboarding documents for new employees. Next slide. House Bill 376. This bill states that the state group health insurance program must include a pensioner coordination of benefits policy, and this will be for eligible pensioners who were first employed by the state on or after January 1st, 2015, and are eligible for healthcare coverage through their employer. This policy must be comparable to the existing spousal coordination benefits policy, and this bill also codified the existing spousal coordination benefits policy. This bill was signed by the governor on September 30th, and the pensioner coordination benefits policy is set to be effect on July 1st of 2026. Next slide. House Bill 377. This bill requires that the state continue to offer eligible pensioners first employed by the state before 1/1/2025, a plan that is comparable to the current special Medicare Medicare supplement plan. For any eligible pensioners who are first employed on or after January 1st of 2025, the state may then at that point offer different Medicare supplement plans so long as they are not high deductible plans. This bill had passed the House and Senate and was enacted without signature on October 1st. And the final bill we wanted to touch on today was House Bill 475. So this amended a Delaware code to provide that certain SG funds accumulated in a prior fiscal year in excess of funds needed may be deposited into the OPEB trust fund. So this was signed by the governor in June and took effect on June 30th, 2024. And that concludes our legislative presentation today. The SBO, of course, is continuing to work with our payers, Office of the Pensions, Employment Services, and other agencies to ensure smooth implementation and full compliance with all these bills.
Think of that, 7 minutes and a lot of work. For everyone listening in, those who aren't here, those in the room, to our cabinet secretaries, to the team here, and to Senator Townsend, I know former Representative Bombach and his efforts, and now we have our majority leader, Carrie Harris, who's here. So I wanted to go through all that to kind of brush the cobwebs off, get the wheels greased forward, for January as the transition occurs, so that people know where we landed and see if there were any comments. And again, I really just want to say kudos to everyone. I know that's been a tremendous amount, and to be able to say that in 7 minutes,
Right.
is a lot. Comments, go ahead, Wayne.
On HB 376,
Yes.
why, and this may just be the code, why is the effective date July 1, 2026?
So this was to allow, there's a lot of work that would need to be done behind the scenes with DTR, Department of Technology, to make sure we have everything in place to be able to basically monitor that policy and ensure full compliance. Additionally, it does require the hiring of a new staff member for the statewide benefits office to monitor and train on that policy. We expect that it would be a very heavy lift and just wanted to ensure that there was significant time to make sure everything is in place. However, I will say we do fully anticipate that this will be ready to go well before July 1st of 2026. So it will be up to the new committee on whether they would like to implement this prior to the July 1st, 2026 start date, which will, like I said, very likely be a possibility, as we fully expect it would be ready within 2025.
Thank you.
Very good. Any other comments here in the room? And if not, I'll go to my co-chairs. I don't know if Senator Townsend or Representative Harris have anything to add. I know they were actively engaged in these bills and their processes. Okay.
Lieutenant Governor, I have nothing to add. I echo your point about how that was quite an efficient summary of what I'll say. What I'll say on behalf of Representative Bombach was a tremendous amount of work. So thank you for that.
Yes, a lot there, and I don't know if Majority Leader Harris is in a position to comment or not, or she's just taking it in today. She might be, yep, go ahead.
No,
Sid.
yes, I was just going to echo what you said and then what the senator said around the presentation, but then follow up again with what the senator said around Representative Bombeck. He put in a lot of work, and we are just so grateful for all that he's done. And then I think the state is definitely going to benefit as a result.
A lot here, a lot of folks here, to the team here, we didn't age you too bad. Right, and to our secretaries, and again, it was consensus, not everything was, I know, 100% consensus, but that is the beauty of government and policy, right? So with that, that leads us on our agenda with our update with Medicville.
Yeah, Lieutenant Governor, I'm gonna take this one as well.
Okay,
So
go ahead.
once again, and this will be fairly brief, but again, I think when we last met in April, one of the things of interest to the subcommittee was understanding preparation, where things were going as we headed towards the Medicare State of Delaware open enrollment, which actually occurred in the month of October. So Carrie, to the next slide, thank you. And I think I have good news to report here, and I've got Joanna here in the room as well, and she can certainly chime in with any commentary from the Office of Pensions, recognizing her mighty team that there is the kind of the HR group for our retiree population, but we work really closely with Joanna and the Office of Pensions in coordination on this open enrollment. So it actually happened October 14th through 25th. We worked together with Joanna and her team and had packets of information that were dropped in the mail to the Medicare retiree population last day of September. And we were able to successfully complete the plan documents for the 2025 plan year and have those all posted on our website at the start of that open enrollment. Additionally, while we were not able to get the contract completely executed by the start of open enrollment, I am happy to report the contract is now fully executed. So we've pretty much buttoned up all of our work for this coming plan year. Next slide, please. A new offering that we tried this year was we decided to go ahead and offer some on-site education sessions for the Medicare population. We held 2 in each county, as well as 2 virtual sessions for those that were not local. We had representation at those meetings from our office, the Office of Pensions, Highmark, and CBS SilverScript. The sessions, unfortunately, were not well attended, including the virtual sessions. A lot of good information that was shared. It's all posted virtually as well. But I think in light of the very light attendance, at least at current, unless there's some significant changes in the subsequent open enrollment periods, I'm not sure that we'll be bringing back those on-site sessions just because of the significant work effort and, quite frankly, the cost in reserving those venues. Next slide. And then I just kind of want to wrap this up by referring back to the rates that will go into effect for the Medicville plans. There's 2 plan options. There's the Medicville Medicare supplement plan with the prescription drug plan offered for CVS SilverScript, and then there's the option of just enrolling in the Medicville Medicare supplement coverage without the drug. As Beth mentioned during her updates on OPEB, there was a 27% rate increase applied to these 2 plans that goes into effect on January 1st. So the new monthly rate will be $612.40 for the Medicville with prescription and $347.20 for Medicville without prescription. Now, important to call out, the state is for the majority of our retiree population, particularly those that retired on or prior to July 1st of 2012. the state is paying 100% of that monthly rate if the pensioner retired with at least 20 years of state service. For those that have retired after July 1st of 2012, they have a 5% contribution, again, if they have retired with at least 20 years of service. So they're paying $30.62 for that medic fill with RX or prescription, and $17.36 for the medic fill without prescription. Excellent. So I'm happy to take any questions. But again, very, I think, uneventful open enrollment. I know Joanna, your team reported that call volume was mostly just verifying they don't need to do anything. There weren't any changes in the medic fill coverage, no changes in out-of-pocket costs under the drug. So it was relatively smooth. And I don't know if you have anything that you want to add.
I concur with everything you said.
Great.
Right, so that's good. Well, we appreciate that, and doing that, and it sounds like you'll be able to make those modifications, for next year, and perhaps not have to have as many open sessions and forums, unlike last year. Yay, right? Okay, that's what we want to hear, right, Wayne?
Yes.
Yeah.
I have a question.
Okay, go ahead. I figured as such. I can feel your energy. And I mind you, it is 2:45, and we
Yes,
had this till
it's a
3.
Quick question,
Okay.
either to Joanna or Faith, can you give me the breakdown between the pre-2012 and after 2012? Is it 50-50 or? And if
You
if
mean
get
the
it-
number of retirees?
Yeah, or the participants,
Oh, what?
and if
It's,
you wanna get it to me later, that's fine. Just,
Yeah.
Yeah, I think you have to get it there.
The last I looked at it, it's a couple of years ago, it's around 50.
Was it-
we send reports to statewide benefits every month, so we have the information.
If you-
Well, she can follow up with an email for folks. when we
Yes,
send
and
out
and
stuff.
actually, Leanne Hinkle, our deputy director, is in the process of, she just received the monthly reporting from the pension office, so she can provide that information as a follow-up to the subcommittee members.
Thanks, I appreciate it.
Any other questions from folks? Because again, with other business, the main intent was not to torture you on this beautiful afternoon, but to dust off cobwebs, get ready for the transition, be thinking about where we stood, to say a sincere thank you to, the cabinet members, to those who have served in the General Assembly, to others, to particularly the advocates, and others who really fought and stood up to make sure that we were moving the state and having retiree healthcare in a certain direction. And I don't know if there's other business that has come up. If not, we can go to the public comments. Yeah, go
Just
ahead.
wanted to make a comment.
Sure.
Madam Chair, if I may. First, thank you to Senator Townsend for creating this subcommittee. It's been one of the best experiences that I've had in public service. I think it's a special group and we've accomplished special things. To Majority Leader-elect Harris, welcome aboard. I served as Majority Leader for 2 terms. I don't know whether to congratulate you or pass on my condolences, but I look forward to working with you moving forward.
That's funny.
That being said, and I'll speak personally, with the horrific outcome of the national election and having gone through Project 2025 and seen some of the plans for public health and the privatization of Medicare, I would hope that since we are statutorily created, that we can work with the House and Senate leadership collectively to keep an eye on things and if necessary, reconvene and place barriers if necessary for what I'm afraid might result over the next 4 years.
And I think that's part of the reason I wanted to have this meeting too. It had been several months to say, reconvene, have a conversation, there will be transition, and certainly if there is need and when to meet, I know the team, both in our pension office and DHR and here, you can make those decisions, and for myself, transitioning out, from Lieutenant Governor for a brief little stint, call it the Dale Wolf term, as governor.
And Dave Buxton.
And Dave Buxton, yes, I was with them today. But it is really, really, I think, important and imperative because, you know, healthcare is that foundational component and equity and retiree health has been critical. And so, again, I just wanted to pull us together. And I think what we can do now, if there's no other dialogue here or among committee members, is anyone, other committee has comments, we'll go to public comment. Anyone else? Comments?
Also, a final comment at the very end after public comment. Thank you.
Okay, Denise will go and then we'll go to public comment and then to Senator Townsend. Yes, Denise.
I just want to say thank you. It's been an honor to work on this committee. It was very interesting and very, I just, thank you.
You're welcome, and we'll see what the future holds, and that will be up to our members of our General Assembly. Thank you. If there are no other members from the committee to comment, we know Brian wants the last word, Senator Townsend. We'll see if there's any members of the public. I see Steve's hand is up, and we'll follow the rules where we give you the 3 minutes, Steve, you know that. And but one thing I do think was a wonderful experience from this process was how we did provide that opportunity, and thanks to the team for allowing us to have that opportunity to have unprecedented public feedback and public comment, and everyone was heard in a special website. I think that really resulted in true transparency and people feeling heard. So with that, we'll go to Steve.
All right, and I just want to let everyone know that we did receive one written public comment from Bob Clarkin that was sent to the subcommittee last week.
Yes.
If you didn't get it, just let me know, I can send it
All
again.
right, so we'll start with Steve now. Go ahead, Steve. Are we gonna expire on the Zoom?
Yes, can you hear me?
Yes, we can.
Okay, great, thank you. I know I've sent out a ton of emails, and some of you guys may like them, some of you guys may file 13 them, but some of the emails that I've sent out most recently has been, and hopefully this committee will address this, you know, in coming future. But with House Bill 350 going by already, I wasn't particularly happy with that bill. I was more toward the Medicare reference-based pricing model versus the CPI model, because the CPI model will take us years to realize any immediate impact to the GHIP versus the reference-based pricing model. They could have been a hybrid of both, but it is what it is now. And so now I've kind of moved on to looking at the pharmacy side, and I've sent emails out concerning that. And I'll give you an example of some of the things that I've done is I've taken like 6 medications that I'm on, and I went to Mark Cuban's website, Cost Plus Drugs, and I compared that when I logged into CVS Caremark using my login for the state plan, and I compared the prices. And just for me alone, for a year's worth of the 6 drugs, it would have been about $400, I think it was on the Mark Cuban site, versus $2,200 for the state plan. So that's a savings of about $1,800. And in one of the emails that I sent, I talked about bulk purchasing and perhaps the state becoming its own PBM, which is what I lean towards. But that would allow the state to reap all the discounts and the benefits you know, from the pharmacy plan, and pass those savings along. They could actually make the drugs a 0 copay and still save an abundant amount of money. But anyway, I wanted to bring that up, and I hope the committee continues doing that. And for those of you that are leaving the committee, I'm sorry to see you go. I think it's been a great experience on this, you know, listening to you guys and learning a lot, actually. So thank you.
Thank you. 30 seconds to spare. Now we have Bob's written comments, and Mr. Clarkin, you do have your hand raised. So I don't know if you want to speak, Bob.
Can you hear me?
Yes, we can.
Thank you. I just wanted to amplify one small item that was in my written comments.
Okay.
At the end of your report that you put out last December, and it's amazing that almost a year has gone by since that report was put out, but there's a table at the end. It's table A3. It has a whole lot of detail, really important detail about the efforts that are being made to address the liability. And since a year's gone by since that was put together, there's been a whole lot of action, especially the $300 million deposit into the OPEB fund of escheat money. And I think I don't know how you would do this now if you're not going to meet on a regular basis, but I think it would be really helpful for someone to take the time to update that report and to transmit it to the governor-elect's transition team. Because, when you first look at those huge liability numbers, it's overwhelming, and you think, how the heck is the state ever going to cover the liabilities? And I think that chart, in a very easy way to understand, demonstrates the path forward. So if it's possible, I think it would be great to update that report and to send it to the transition team. Thank you.
Great, thank you for that. Any other members of the public? I don't see any other hands raised. And any other member, anybody going once, twice? We'll go to Senator Townsend.
Thank you, Lieutenant Governor. I just want to note a lot of thanks and praise was shared, and I think a lot of it rightfully so to various people. And shout out to staff, but also to you, Lieutenant Governor. I remember when we first talked about this idea, I very much felt that you were the absolute perfect person to lead this group.
Thank you.
And I think that bore out exactly the way that anyone who's worked with you knew that it would, in terms of a tough issue and a lot of viewpoints, trying to hammer out agreements and understanding amongst various people. And I truly, truly appreciate the impact you've had. And when we sit in this room, the public input has made very clear to us how this affects people's lives personally, but even that is only a small sliver of the tens of thousands of Delawareans this affects on an annual basis. And on behalf of all of those individuals, thank you so much for your efforts here.
Thank you, thank you, well, thank you. Well, I didn't come for the applause, but however, we can pat each other, but thank you, Senator Townsend, I know, and there, and that is the beauty of policymaking and politics, right? Is being able to get together and come up with some good ideas, and when you have unintended consequences, you address those. And so if there are some that fall out from these efforts, they'll have to be addressed, and I know that they will be. And having said that, I think what will happen then is, with your leadership to, our majority leader, to Senator Townsend, working with the teams here, both in the pension office and DHR, with the good transition team, future governor, you'll be able to make a decision, should and when meetings need to occur. But again, I felt it was really important to not leave anything open. And as promised, I was going to be done by 3. I promised you. So with that, I wish everyone a healthy, happy Thanksgiving, which is a couple weeks away. In the meantime, a sincere thank you. It's been a privilege to lead on this issue. It's not over. I think, as you were stating, we're going to have a lot on the healthcare radar all the way around. And so thank you all for that effort. I'm going once and twice and 3 times to the staff. Nobody else has popped up. Okay, do I have a motion for adjournment?
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Thank you all. Have a great day. 2:58. I said an hour plus.